It's the middle of the night, and your tooth is pounding so hard it feels like it has its own heartbeat. The pain is deep, constant, and impossible to ignore. You turn from side to side, hoping it will ease, but it doesn't. You already took painkillers. You even started antibiotics. Still, nothing works. At this point, most people stop caring about drug names or medical explanations. They just want the pain to stop. And that's when a strange, unexpected word sometimes shows up in conversations or online searches. Gabapentin. It sounds serious. It sounds different. And it raises a big question. Why is a nerve medicine being mentioned for tooth pain? And more importantly, when does it actually help? And when can it make things worse? To understand this, you need to understand one simple but powerful truth. Not all tooth pain is the same. Most people believe that a toothache is just a toothache. But that belief causes many mistakes. Tooth pain can come from very different sources, and each source behaves differently. Some pain comes from infection, some comes from pressure inside the tooth, and some comes from nerves that are irritated or damaged. When nerves are involved, the pain follows different rules, and treating it like normal pain often fails. Inside every tooth are tiny nerves packed into an extremely small space. They are sensitive by design. When something goes wrong, like decay, inflammation, or trauma, these nerves react immediately. They swell. Pressure builds up. And because they are trapped, even a small problem can cause intense pain. That's why dental pain feels so sharp and overwhelming compared to other types of pain. But here is the detail many people miss. The type of pain matters just as much as the intensity. Typical tooth pain often feels dull or throbbing. It gets worse when you bite down or chew. Cold drinks, hot tea, or sweet foods can trigger it. This kind of pain usually points to inflammation or infection. Nerve-related pain feels very different. It can feel burning, like heat inside the jaw. It can feel shooting, like sudden stabs that come without warning. Some people describe it as electric shocks running through the tooth, jaw, or even the ear. This pain may appear suddenly, disappear for hours, and then return stronger. It often becomes worse at night. And most importantly, regular painkillers barely touch it. When someone goes to a dentist with tooth pain, treatment usually begins with standard steps. Painkillers are prescribed to reduce discomfort. Anti-inflammatory medicines are added to control swelling. If there is a clear infection, antibiotics are given. For many patients, this works well. The pain settles down. The infection clears. The tooth receives proper treatment. End of story. But for some patients, something strange happens. The swelling improves. The infection resolves. Yet the pain does not go away. In some cases, it even feels worse. This is where confusion starts. Patients assume the medicine is not strong enough. Some think the dentist made a mistake. Others jump from one drug to another, hoping something will finally work. But in many of these cases, the real problem is not infection or inflammation anymore. The problem is nerve pain. And nerve pain does not behave like normal pain. Anti-inflammatory drugs are excellent at reducing swelling. Antibiotics are powerful against bacteria. But nerve pain is a signal problem. The nerve keeps sending pain messages to the brain, even when the original cause has been treated. The alarm system stays active. This is the moment where gabapentin quietly enters the discussion. Gabapentin was never designed for tooth pain. It was originally developed to treat seizures. Later, doctors noticed something interesting. It helped people with nerve pain. Pain caused by damaged or overactive nerves. Burning pain. Shooting pain. Electric pain. Gabapentin works inside the nervous system, not at the site of injury. It does not block pain like typical painkillers. It does not reduce inflammation. It does not kill bacteria. Instead, it changes how pain signals travel from the nerve to the brain. In simple terms, it turns the volume down. This is why gabapentin may help in very specific dental situations. For example, after a difficult dental surgery where a nerve has been irritated or slightly injured. Some patients experience pain that feels abnormal and out of proportion to what the tooth looks like. Burning sensations, tingling, shooting pain that spreads into the jaw, ear, or side of the face. In these cases, painkillers fail. Antibiotics do nothing. When nerve involvement is suspected, doctors may consider gabapentin, not as a cure, but as a temporary way to calm the nerve while healing continues. Another situation is post-procedure nerve sensitivity. After a root canal or wisdom tooth removal, most people heal normally, but a small number develop lingering nerve pain. The tooth may be treated correctly, but the nerve remains irritated. This pain can last for weeks or even months. In carefully selected cases, gabapentin may help reduce abnormal nerve firing and allow the nervous system to settle down. But here comes the most important warning. Gabapentin does not treat teeth. It does not fix cavities. It does not drain abscesses. It does not cure gum disease. If the pain is caused by infection, gabapentin is the wrong choice. If the tooth is cracked or structurally damaged, gabapentin will not solve the problem. Using it in these situations can be dangerous. It can mask pain while the real disease continues to worsen underneath. Think of pain like a fire alarm. If the alarm is ringing because there is a real fire, turning down the alarm does not stop the fire. It only delays action. That is exactly what happens when nerve medicines are used incorrectly for dental problems. The warning signal is silenced, but the damage continues. Gabapentin also comes with risks that should never be ignored. Many people feel drowsy or dizzy when they take it. Some feel mentally slow or disconnected. Brain fog is common. Others feel unsteady and off balance. With long-term use or misuse, dependence can develop. This is why gabapentin should never be self-prescribed. It is not a casual drug. It requires proper dosing, medical supervision, and a clear reason for use. This is also why dentists and doctors are very cautious with gabapentin. Its use for dental pain is often off-label, meaning it is not officially approved for this purpose. Doctors only consider it when the potential benefit clearly outweighs the risks. Usually this means short-term use at the lowest effective dose. Long-term use is avoided unless absolutely necessary and closely monitored. So what should you do if your tooth pain is not going away? First, never ignore persistent pain. Pain that lasts is always trying to tell you something. Second, do not jump from medicine to medicine hoping for a stronger fix. Strong drugs do not replace diagnosis. The most important question is simple. Is the pain coming from infection, or is it coming from nerve irritation? This distinction matters more than how severe the pain feels. Severe pain does not always mean severe infection, and mild pain does not always mean a small problem. Only proper dental examination can determine the real cause. In some cases, dentists and doctors may need to work together. The dentist treats the tooth. The doctor manages nerve pain if needed. This coordinated approach prevents long-term damage and avoids unnecessary medication use. So let's be very clear. Gabapentin is not a cure for toothache. It is not meant for routine dental pain. It is not a replacement for proper dental treatment. But in certain nerve-based dental pain, when used carefully and for the right reason, it can reduce suffering while real healing takes place. The smartest treatment is not the strongest drug. It is the right treatment for the right cause. Pain is a signal, not an enemy. Listening to it matters. And when it comes to tooth pain, understanding the difference between nerve pain and dental disease can save your teeth, protect your health, and prevent a lot of unnecessary suffering.